Welcome to AI DocuFeed, where we break down complex documents into easy-to-understand podcasts. Today, we're tackling the official Medicare and U 2025 handbook. Be sure to check the show notes for links to FAQs and worksheets you can use to follow along or fill out after the show. Please note, this podcast is for informational purposes only and does not provide financial, medical, or tax advice. Always consult a qualified professional for your specific needs.
Hey everyone, and welcome to our deep dive into the Medicare changes coming in 2025. We're focusing on what's most important for baby boomers like you this year, bring some of the biggest updates we've seen, and understanding these can make a real difference, in your healthcare and your wallet.
Let's get started. We'll break down these changes, in a way that's easy to understand and really see how they can actually impact your life.
First up, let's talk about something we all care about, saving money.
Right.
Specifically on prescription drugs, which can be, a real drain on your budget.
Yeah, one of the biggest changes in 2025 is the new $2,000 annual cap on out-of-pocket costs for medications under Medicare Part D. That means no matter how expensive your prescriptions are, you'll never pay more than $2,000 out of pocket in a year.
That's a huge relief for so many people. It's like having a safety net for your medication expenses. No more worrying about those sky-high bills.
It gives you peace of mind knowing your costs are predictable. This change could also put pressure on drug companies to be more mindful of their pricing, which is something we'll be watching closely.
Now, along with that cap, there's a new tool to help manage those costs. The Medicare Prescription Payment Plan. What's the deal with that?
This plan lets you spread your medication costs throughout the year, making it easier to budget. It's like setting up a monthly payment plan for your prescriptions, just like you might have for a car or a mortgage.
So instead of one big bill, you have smaller, more manageable payments. It takes a lot of the stress out of managing your medications.
And speaking of making healthcare easier, let's talk about telehealth. We all got used to seeing our doctors from home during the pandemic, and now there are some important changes coming.
This is a big one, especially for folks who may not be as mobile or live far from specialists. What do we need to know about telehealth in 2025?
Well, there's good news and some not so good news. The good news is that mental and behavioral health services will still be covered through telehealth from your home, which is a big win. But after December 31st, 2024, you'll have to be at a medical facility in a rural area to get most other telehealth services covered.
So if you're in a city and rely on telehealth for things like follow-up appointments or managing chronic conditions, that could be a problem.
It does raise concerns about equal access to care for everyone, regardless of where they live. It's something to keep an eye on and advocate for.
Absolutely. Now let's dive into another area where Medicare is expanding coverage, mental health services. This is incredibly important for overall well-being, especially as we age.
Medicare now covers services provided by marriage and family therapists and mental health counselors, not just psychiatrists. They've also expanded coverage for intensive outpatient programs.
That gives people more choices and flexibility to find the right mental health professional for their needs. It's about breaking down those barriers to getting the support you need.
It's a sign that mental health is finally being recognized as a crucial part of overall health. It's about time.
Now let's talk about the foundation of Medicare parts. A, B, C, and D. It could feel confusing, but we'll make it clear.
Let's start with Part A, which covers hospital stays. Most people get Part A premium free if they or their spouse worked and paid Medicare taxes, but if you need to buy it, you'll want to be aware of potential penalties for enrolling late.
So it pays to get enrolled on time. Now, what about Part B? What does that cover?
Part B covers outpatient care, which is a big part of your day-to-day health care. That means doctor visits, preventative screenings, and even some mental health services.
So things like your annual checkup, those cholesterol tests you get, and even getting help with managing stress would fall under Part B.
Exactly. It also covers things like screenings for women's health and programs to help prevent diabetes. It's designed to keep you healthy and catch potential problems early.
And what about telehealth? Is that covered under Part B?
Yes, some telehealth services will still be covered under Part B from your home, even after those location restrictions kick in, so you can still access certain types of care remotely.
That's good to know. Now, Part B also covers important things like X-rays, MRIs, and CT scans, right?
Yes, those are all considered diagnostic tests, and they're covered under Part B. These tests can be expensive, so having that coverage is essential.
Now, what about Part C? This is where things can get a little tricky for some folks.
Part C, also known as Medicare Advantage, is an alternative to original Medicare, which includes Parts A and B. These plans are offered by private insurance companies and have to cover at least the same services as original Medicare.
So it's like getting your Medicare coverage through a private insurer instead of directly from the government. What are the advantages?
Medicare Advantage plans often include additional benefits like dental, vision, and hearing coverage, which can be a big plus. They may also offer more telehealth options than original Medicare.
So if you're looking for more comprehensive coverage, Medicare Advantage might be a good option, but it's important to compare plans carefully to see what's right for you.
Absolutely, not all plans are created equal, and it's crucial to find one that meets your individual needs and preferences.
Now let's talk about the last piece of the puzzle. Part D, this is the one that covers prescription drugs, right?
Yes, Part D is your prescription drug coverage, and it works hand in hand with that $2,000 out-of-pocket limit we talked about earlier. So you'll want to enroll in a Part D plan to take advantage of that cap.
And like with Part A, there are late enrollment penalties.
That's correct. If you delay enrolling and go without creditable drug coverage for a certain period of time, you'll face a penalty that gets added to your monthly premium.
So it's important to enroll in Part D when you're first eligible to avoid those extra costs. And to clarify, this penalty stays with you as long as you have Part D.
Yes, that's an important point. It's not a one-time fee. The penalty remains in effect for as long as you have Part D coverage.
So it really pays to get enrolled on time. Now we've covered a lot of ground so far, and it can feel overwhelming, but we're here to help you make sense of it all.
The more you understand, the better equipped you'll be to make informed decisions about your health care.
And before we move on to real-life examples of how these changes might impact you, let's take a moment to clarify a term you might hear a lot: Medigap.
Medigap policies, also called Medicare Supplement Insurance, are sold by private companies to help cover some of the costs that original Medicare doesn't.
So it's like an extra layer of protection to help you manage those out-of-pocket costs. This is especially important for people with certain health conditions who might have higher healthcare expenses.
Exactly. Medigap can help fill in the gaps and give you peace of mind knowing you're covered for those unexpected costs.
So we've got original Medicare with Parts A and B, then Medicare Advantage, or Part C, which is an alternative, and Part D for prescription drugs, plus you can add Medigap for extra coverage. Let's move on and see how these changes play out in real life.
So we've covered the, nuts and bolts of these Medicare changes, but let's bring this to life with some examples, Think of it like trying on a new outfit. You want to see how it actually looks and feels before you commit.
Sometimes it's hard to picture how these changes will actually affect us day to day. Let's start with that $2,000 prescription drug cost cap. How might that play out for someone dealing with a chronic condition?
Imagine a person who relies on several medications for rheumatoid arthritis. Their monthly drug costs can easily reach $500 or more. Before this cap, they could end up paying thousands of dollars out of pocket each year, putting a real strain on their budget.
Especially for folks living on a fixed income, that can be a huge burden.
But now they have a safety net. They know they won't be hit with a massive bill. They can budget more effectively and focus on their health without the constant financial worry.
Speaking of managing health, let's look at how those telehealth changes could impact someone's access to specialized care.
Let's say someone lives in a rural area and needs to see a cardiologist. Regularly driving long distances for appointments can be tough. Especially as we get older, telehealth can be a real lifesaver in those situations.
It's all about convenience and making healthcare more accessible no matter where you live.
But with those location restrictions coming back for some telehealth services, it's not a perfect solution. Someone living in a city might find it harder to access the same level of care remotely.
That's where those concerns about equity come in. We need to make sure everyone has fair access to the health care they need, whether it's in person or through telehealth.
Now let's shift gears and talk about those expanded mental health services. These are a game changer, especially for baby boomers who might be facing new challenges in their lives.
It's about time we start talking more openly about mental health. It's just as important as physical health. Especially as we age, we all need support from time to time.
Imagine a caregiver who's been looking after a spouse with Alzheimer's for years. It's an incredibly demanding role, both physically and emotionally. They might be struggling with burnout, anxiety, or even depression.
Those new programs that provide resources and support for caregivers sound like a godsend.
These programs can offer training on how to handle difficult behaviors, connect caregivers with support groups, and even provide respite care so they can take a break and recharge.
That can make a world of difference not only for the caregiver's well-being, but also for the quality of care they can provide.
And it's not just about emotional support. Caregivers often have to cut back on work or even quit their jobs to provide care, which can lead to financial stress.
These programs can offer financial assistance, and connect caregivers with resources to help them manage their responsibilities without sacrificing their own well-being. It's about recognizing the vital role they play and making sure they have the support they deserve.
These Medicare changes are really about adapting to the needs of a changing population. Baby boomers are facing different health challenges and have different expectations for their care than previous generations.
It's about recognizing that healthcare is not one size fits all. We need options that are flexible, affordable, and focused on the whole person, not just their physical symptoms.
And it's about empowering people to take a more active role in managing their own health. These changes give you more tools and resources to make informed decisions about your care.
So what does this all mean for our listeners? How can they prepare for these changes and make sure they're getting the most out of their Medicare benefits?
First and foremost, knowledge is your best defense against confusion and costly mistakes. Read up on the changes, talk to your doctor, and don't be afraid to ask questions.
It's like anything else in life. The more you know, the better prepared you'll be.
Second, take the time to review your current Medicare coverage. Does it still meet your needs? Are there any gaps you need to fill? Think about your health goals and your budget, and don't be afraid to make changes if necessary.
It's like spring cleaning for your health insurance. Dust off those old policies and make sure they're still working for you.
And remember, you don't have to do this alone. There are resources available to help you navigate these changes and make the best decisions for your situation. Medicare.gov is a great place to start for information and plan comparisons.
And don't forget about those friendly folks at the State Health Insurance Assistance Program. They offer free, unbiased counseling to help you understand your Medicare options and make sure you're getting the most out of your benefits.
They're a valuable resource, especially if you're feeling overwhelmed or unsure where to turn. Remember, advocating for your own health is crucial.
It's about taking charge of your healthcare journey, not just passively accepting whatever comes your way.
Exactly. These Medicare changes give you more control and more options, but it's up to you to use them wisely.
And that brings us to our final and perhaps most important question for our listeners today. How will you use these changes to improve your healthcare experience in 2025?
Take some time to reflect on your individual needs and goals, what matters most to you when it comes to your health and well-being. How can these changes help you achieve those goals?
Yeah, it really is empowering to think, we have more control over our healthcare than we think.
Absolutely. These Medicare changes are a step in the right direction, but it's up to each of us to, engage with the system, ask questions, and advocate for our needs.
We've covered a lot of ground today, from prescription drug costs to telehealth to mental health services, and we've seen how these changes can make a real difference in the lives of baby boomers. We hope this deep dive has given you a clearer understanding of what's ahead for Medicare in 2025 and the tools you need to navigate these changes with confidence.
Remember, don't be afraid to ask for help when you need it.
A big thank you to all our listeners for joining us today. We're here to help you make the most of your Medicare benefits and live your healthiest life.
Thanks for joining us on AI DocuFeed. We hope this episode helped make Medicare a little clearer for you. Don't forget to check out the show notes for the frequently asked questions and worksheet to keep learning and organizing your next steps. If you found this episode helpful, please subscribe, leave a review, and share it with someone who could use a little Medicare guidance. Join us next time as we continue to simplify complex documents and help you take control of the information that matters most. See you soon.